Hello, I'm Dr. Robert LaLouche, a board-certified OB/GYN physician with over 30 years of clinical experience. And today we're going to talk about acetaminophen or Tylenol in pregnancy. There's been over the last few years and recently some patients have mentioned some concern about Tylenol or acetaminophen during pregnancy. It is one of the most widely used and recommended medications in pregnancy, and overall, long story short, I believe it is okay to continue recommending Tylenol in pregnancy, but everything in moderation. You may have seen my other video where I commonly recommend that you follow the general rule of thumb for all medicines or all things in life, everything in moderation. Not enough of something can be of harm, and too much of anything can be of harm as well. So we all, I'm sure, are aware that excessive Tylenol can be life-threatening and dangerous, and certainly the case is in pregnancy. But even if not pregnant, there can be liver damage, so it is not a medication to take its use lightly. However, not taking the medicine can create consequences as well. For example, fevers. So fevers in pregnancy can cause miscarriage and cause birth defects. Teratogenic, so high fever. So taking Tylenol early in pregnancy can potentially avert a miscarriage or birth defects. So one of the recent questions that's been raised by some patients is a link or association with ADD or ADHD. And most of the studies demonstrate weak links, weak associations, some not statistically significant. And so overall, with my years of experience, my guess is that the association is unlikely. However, we don't have proof. Now, what do I mean by association versus cause and effect? Well, let's say that you are somebody who's never been outdoors in your whole life, and for the first time you go outdoors and you see a bunch of people with umbrellas and rain. You're like, So you see umbrellas, you see rain. Next day there's no rain, there's no umbrellas. After a few days later, it starts raining again, you see umbrellas. And pretty soon you say, umbrellas must cause it to rain. Now, obviously that's not correct. But just because two things occur together often doesn't mean one causes the other. Obviously, in response to the rain, people bring out umbrellas, but you could incorrectly assume that bringing out an umbrella causes the rain. Kind of a strange story, but what I'm trying to say is there is no good studies demonstrating any cause and effect between two things that might, in some studies, have a little higher association, meaning ADHD or ADD and acetaminophen use in pregnancy. Okay? That being said, if you have a high fever, we recommend that you do always involve your care provider in your treatments, and also be careful about excessive use, continual excessive use for the minorest of circumstances throughout pregnancy, or even when you're not pregnant, is definitely not recommended. And if you're needing that much use, you should discuss in detail with your provider to come up with alternatives to handle your discomfort, your pain, your temperature, or whatever reason why you're taking that medicine. So I hope you found these comments of use. Please leave your own comments. Thank you.